Hi, my name is Haley Brown, and I intern at the Extension Women's Campus in Marietta, Georgia. The Extension is a long-term in-resident treatment facility for homeless men and women who have chemical dependency to drugs and/or alcohol. The goal of the Extension is to provide the tools necessary for these men and women to live sober and healthy lives. The Extension was formerly the Marietta Cobb Winter Shelter, founded in 1987. It was in place as an emergency shelter during the winter for homeless men and women. Um, After a few years, the men and women who were running the facility were recognizing that there was a much larger issue and that was causing homelessness, and it was substance abuse. So in 1995, the extension was the name was changed to the extension, and its mission was changed as well to provide counseling and other services for substance abusing men and women. There's a men's campus also in Marietta. The campus holds 47 beds, and the women's campus holds 20 beds. At the women's campus, there are two clinicians, Miss Wynema, who is the program director, and Miss Courtney McClure, who is the case manager and the other counselor. It is a year-long program on average. The women who live here must hold jobs as well and maintain a sober environment and must remain sober as well. They provide sources to the women, and the extension is a not-for-profit organization, so most of their resources do come from outside sources. As you see here, the federal and state grants are the largest income provider. Also, resident fees. As the men and women work, they must pay 20% of their paycheck each week to the facility as rent payment. Also, churches donate, individuals donate, private foundations, special events, and even Cobb County generates income for the extension. On the right graph, it shows you an expense. So program services cost about 87%, management in general are 6%, and then fundraising is 7%. The services provided to these men and women, some of these classes and sources. Recovery 101 is a class which all of the Phase 1 girls for the first 6 months must go to. It's history, disease concept, policies and procedures, programs, intro to conflict resolution, medical assessment, and community resources. It's kind of just like an entry level class where it kind of gives an overall view of substance abuse and other things. Uh, and in the counseling sessions, the clinicians provide individualized treatment plans that define goals and objectives. And in the individual substance abuse counseling, they also talk about why they're homeless and why they began using, and um, kind of start working out the underlying trauma that it causes a lot of substance abuse problem in these women. Other services, conflict resolution, it's similar to anger management and how they identify anger and how anger is a secondary emotion, and they figure out what the primary emotion is underlying the cause of anger, and how they can better be assertive and not be quick to anger. Life skills, including budgeting and finances, parenting, toxic relationships, and overall learning how to live responsibly. The women do have a budget of each week of $50. They can't spend anything over than that, and if they do, they get consequences or love chores, as they like to call them. Um, and oftentimes the clinicians will reduce their budget to $20 a week if they go over their budget of $50 a week. I do know a woman who kept going over her budget, and she, for 2 weeks, was allowed to spend no money. Um, the shelter also gets a lot of donations for food and stuff like that and clothes. So the women are provided for in that kind of way. So they don't often have to spend money on like breakfast and lunch and dinner and new shoes and new clothes because they're donated. We also provide GED testing and placement for women who would like to go that route. I do know a woman who recently just got her GED and she is really proud of that. They go off campus twice a week to study and work with a um, tutor, and then they're allowed to go off site and take the GED as well. Um, the clients also must participate in 12-step program. The facility is 12-step program based. So they all have sponsors who come on campus and help them work the 12 steps. Their sponsors are usually women who have completed the program before at the extension, and they act as guiders and providers and there for someone to talk to and emotionally lean on if need be. So some of my duties as an intern for the first couple weeks and throughout, I started off as kind of like a receptionist. I had clerical duties, including but not limited to answering the phones, administering pre-screens to potential clients. So every day we would get about 8 to 10 women calling to see if there were any beds available, and if we did have beds available, we would take a pre-screen, and the pre-screen just is constituted of certain questions such as name, age, if you're homeless, what drugs or alcohol you're addicted to, if you have insurance, if you have kids, if you are currently in jail, who are you living with, and if you have mental health medication or other prescription medications. And the extension is a program that does not allow dual diagnoses. So that means if they're bipolar or schizophrenic or something of that nature, we're not allowed to take them. But if they do have anxiety or depression, those are kind of minor dual diagnoses, and we're allowed to treat those women. Um, I also had to file important documents, so all of the intake paperwork I had to file, residence pay stubs and proof of payment of rent I had to file, faxing, taking messages for the clinicians, and then greeting whoever came onto property, such as volunteers and guests, and then creating spreadsheets as well for tracking spending sheets or their when they go to a program or a class, they have to get a sign off on each of those. So I would create spreadsheets for them as well. Um, After the first couple of weeks, I was allowed to participate in lead group counseling sessions such as Recovery 101, Anger Management, Codependency, and Boundaries. Those are really fun, and I would come up with fun activities for them to do. Um, Such as for Recovery 101, we played emotional Jenga, which is they would pull a Jenga piece and it would have an emotion on it, such as anger, happy, excitement, depressed, sad, scared, and they would explain a situation in which they were at that made them feel that kind of emotion and then talk on it, and the class would talk as well. I would complete proper forms for intake and processing. These forms were a lot. At times, it would take about 2 hours for one client to fill out all of the forms. And then I would have to file them and put them away. It's pretty much just rules and regulations and other things like that. Um, Transportation, relationship statements, proof of homelessness, income verification, stuff like that. Biopsychosocials I had to complete, and that's just an overall kind of mental status of the patient and where they're at, what their family history is like, what their history with drugs and alcohol is like, and trauma if they have any, which they often do. One-on-one counseling sessions I would sit in on. I wouldn't really participate. I would just kind of be like a fly on the wall and watch the clinicians and the clients interact in that kind of setting. And then the women have homework each week that is assigned to them by the clinicians, and the clinicians would allow me to look over them and make sure that they're answering them properly and doing what they need to be doing. The program director is Miss Wynema Barber. She has many certifications and she has been in addiction counseling for over 20 years. She has a CAC1 license, a CADC2 license. She is certified by the Georgia Addiction Counselors Association as well as the National Association for Alcohol Drug Addiction Counselors. She is also a certified sex addiction therapist and a trauma therapist. She recently just got her certification for trauma therapy, and she has studied at the University of Georgia and Kennesaw State. So, substance abuse and homelessness in women. There are many social factors surrounding substance abuse and homelessness, including policy efforts that need to change to benefit these vulnerable populations, such as raising minimum wage, expanding jobs, improving quality and quantity of low-income housing. There is not enough housing for these type of women and for these services. There is there are little ways for these men and women to improve their life. It's really hard to they get a leg up. Um, they have limited income, so there is no access to proper clothing or adequate housing for safety and security needs. They wish to have to retreat to receive a better education and employment, but there is a lack of information and resources and a lack of childcare services. Housing is most important. They wish to live independently, but because of criminal records or poor credit and lack of employment, that hinders them. Um, Homelessness is not an individual problem, it's a social problem as well, and individual traits and behaviors, um, but rather in a broader social and economic context. Um, a lot of the women that come through our facility are mothers who have chemical dependency issues, and a lot of them are older in their 40s and 50s sometimes, and they often did not receive help at a younger age because they had a fear of their child being removed, or there was not a proper child care services for their children, and they feared that they would be mistreated and stigmatized by by the larger society. Um, I use functionalist theory. Functionalist theory states that the large social institutions work together in order for the society to be stabilized. I looked at this as society being the extension, and the clinicians, the house sisters, and then honesty and accountability allow for the women to in this program to remain running smoothly. The clinicians punish or they get onto the women if they're not following the rules, and they get house chores and or love chores, or they get property restriction. The house sisters are for women who are kind of put in charge, who are also in the program, and they have an account. They hold people accountable for their actions, and if they're not cleaning or if they're not doing their chores or if they're doing something wrong, they will tell the clinicians, and the clinicians will hand out a proper punishment. Linking to society. Um, what I've noticed, there is a lack of funding resources for facilities like this. And that's a huge problem because people can't find the help they need. They are vulnerable populations and they are more likely to have health issues and an inaccessibility to proper health care. And they are also stigmatized by larger society and looked down upon as problems rather than people. I've learned that funding and resources need to be increased to provide more services to the population. The criminal justice system would rather incarcerate these women and men than rehabilitate them. And a lot of these people have codependency problems and have never set boundaries before in their life. And those are my references. Thank you.